Are my painful, heavy periods in my 40s a normal part of aging? Women don't ask about this casually. They ask about it exhausted. My period used to be manageable, and now I have to plan my calendar around it. I cannot leave the house in the first 2 days. I'm soaking through everything, and I'm drained for an entire week afterwards. And then someone tells them it's just your age. So they begin to wonder, do I just have to live like this? Here's the truth. Heavy, painful periods are common in your 40s, but common doesn't mean you have to accept it without understanding it, and it doesn't mean you can't do something about it. The first shift that usually happens in perimenopause is a decline in progesterone, not estrogen. Progesterone helps balance estrogen, and that affects the uterine lining when you have more estrogen. So more lining means heavier bleeding. And when progesterone is lower, the calming anti-inflammatory effect it provides are lower too. So often people will have more cramping and discomfort. So now we layer in stress, and this part matters more than people realize as well. When you're under chronic stress, whether it's emotional stress, over-exercising, under-eating, poor sleep, or just all the responsibility you carry every day, your body will always prioritize cortisol production. And cortisol and progesterone share the same building blocks. So when stress is high, progesterone is even lower. So that means estrogen dominance, heavier cycles, more PMS, more pain, more mood swings. And when you bleed heavily, your body gets more and more depleted. And then it's a loop. So you don't feel control of your body anymore. But here's what I want you to hear. This is physiology, not punishment, not weakness, not something you caused. And when we support you in the correct way, progesterone signaling can improve. And we can often give you additional hormones if you need it. Hi, I'm Dr. Casey Tramp. I'm a licensed medical doctor and functional medicine practitioner. I focus on helping women suffering with tough and challenging thyroid and hormone issues. My approach to complicated thyroid and hormone issues is very different from others. In my practice, I utilize the very best of traditional medicine along with the very best of functional medicine to help my patients regain their health and get symptoms under control. Are my painful, heavy periods in my 40s a normal part of aging? We also always look at your iron levels because heavy cycles lead to iron deficiency, and that amplifies the brain fog and the fatigue. So this is layered. It's not just take a birth control pill and wait it out. It's understanding that hormone choreograph is happening underneath. Your cycle changing is not abnormal, but it is all about communication. And when we listen properly, cycles often become much more manageable. You deserve to feel steady in your own rhythm. Visit the link you see with this video to schedule a consultation with our office now. We'd love to explore how we can help you and any unresolved hormonal issues you may be dealing with.